With Cleves Publishing Incorporated, we assure you as our partners to be there throughout the journey. We are with you in every step of the way. Technology is continuously evolving, and Cleves is riding with it. From print to digital, Cleves got you covered with the products that we offer. Spearheading Cleves products are the Clevelets, an e-learning portal for teachers only, and the Leveraging Education, Augmenting the Future, or LEAF, for student-teacher access. For teachers, administrators, and school owners, we have the Cleves Shares. It is perfect for you in maneuvering fast-paced demands of the education field as we collaborate in creating a balanced amalgam of theories, pedagogies, and practices inside and outside of the realm of the learning environments. Reimagine, reinforce, recognize, to make quality education through a variety of lectures, trainings, and webinars in aid of instruction, classroom management, and institution management. These offerings are perfect responses. In connection to Cleves Shares, to provide service beyond sales, Cleves also has the Cleves Cares for its partner mission schools in providing them with capacity building focused branding or rebranding the institution inside and out. It also practices reimagining various school scenarios and responses to the needs of the time, reinforcing school climate and culture through different webinars conducted among institution partners and in recognizing the value of each stakeholder in the success of value-laden instruction delivery. Another product of Cleves is the Cleves Assist. This offering features a 24/7 hotline for technical assistance in the use and maintenance of the Clevelets and LEAF. Almost everyone in the academe can benefit from this, from the teachers, admins, and school owners to the students and parents. Cleves Assists aims to provide an assistance response team to address immediate technical concerns while ensuring the users the full utilization of the Clevelets and LEAF. It also offers visits with partners to address offline concerns when needed. We ensure quality service delivered through this hotline assistance to our partners, always. And lastly, Cleves Thinks. Together with the partners, we provide them with external consultations for present and future research agenda, accreditation certification, and imaging one. Cleves thinks that with a client in full swing, it is redirecting the winds within their institutions. Cleves Thinks is for teachers, administrators, school owners, students, parents, and even extended service communities and collaborative partner agencies. Through innovative designs, proactive responses, and reconfigured goals, established institutions are on the verge of the fourth going to the fifth industrial revolution. Strong definitive vision is what's needed in remaining relevant and competent in this world. And this is what Cleves is all about.
A blessed morning to all the administrators, teachers, personnel, students, and parents of CEAP member schools from Luzon, Visayas, and Mindanao. A pleasant morning as well to all the friends of the Catholic Educational Association of the Philippines who are watching us today. I am Father Thadeo Enrique Balongag, currently the Vice President of CEAP, and I will be your host today. Before we proceed with our webinar, let us pray to God, the Father who gave us new life through the risen Christ. In the name of the Father, and of the Son, and of the Holy Spirit, Amen. Loving Father, we praise and thank you for another wonderful day, a day that is filled with so much hope by the resurrection, a day that is made radiant by the presence of Jesus, and a day that is filled with love by his selflessness. We bring to you all that we have and all that we are, our imperfect lives that continue to seek peace in these times of health crisis, uncertainty, and fear. We ask you to bless our plans and the good that we seek to do, that we may contribute to the building of your kingdom here on earth. Use each of us, unworthy we may be, to realize your plan and to unfold your will, that together we all may pursue everything that unites, everything that is true, everything that is good, and everything that is beautiful. We gather now in search of ways that can take us out of the pit that have paralyzed us, that have kept us from building our lives, and that have kept us apart from people we love. Send your Spirit to guide us, that the plans we make and the actions we take may truly lead us to you. All this we pray in Jesus' mighty name, for your glory and honor, and through the intercession of Mary, our Mother. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Once again, good morning. I am coming to you live from the city of gentle people, Dumaguete. Welcome to the last leg of our three-part webinar of our CEAP Information Campaign on COVID-19 vaccination, titled VAC to the Better Normal, Vaccine Rollout in the Philippines. We are live both on the CEAP Facebook page and in the CEAP channel on YouTube. Feel free to continue sharing this to your fellow administrators, teachers, parents, classmates, and to your associates, so that they too can join and learn. Let me give you some reminders. First, on questions. As the talk is ongoing, we encourage you to post your questions or comments in the comments section of Facebook and YouTube, and I will raise these questions during the Q&A for our resource persons to answer. Second, on certificates. Please be informed that your certificates will be given to you only upon completion of the evaluation form. The link has already been posted as part of the caption of this video, both in YouTube and Facebook. But please note that the link will only go live from 11:30 a.m. to 5 p.m. today. If you click it now, it is not going to open. I encourage you to answer the evaluation form, and you will receive your certificate of attendance within 3 to 5 days. Finally, on resources, please be reminded that this is a free webinar brought to you in partnership with Tech Factors, Cleves Publishing, Unilab Philippines, and the Manila Health Department. Again, we are giving this to you for free. If, however, you want to pay it forward, you may donate to our Kapatirang Kamagong Fund. The fund is for helping the poor and struggling CEAP mission schools because we believe that no CEAP school should be left behind. Please share this webinar to your network with hashtag CEAP Cares and hashtag I love Catholic Ed. Last week, we invited Father Nick Austriaco Opie to explain the science behind vaccination in the session on VAC to Basics. He clarified issues and concerns hounding the world's response to the pandemic. A lot of Filipinos are afraid to get the vaccine and to submit themselves to vaccination because of information and fake news that are floating in social media. So he gave us facts and figures and, in a straightforward manner, prodded everyone to take the first vaccine that comes along. 2 days ago, we listened to 3 dynamic resource persons who shared their personal journey to vaccination in the session on VAC to VAC stories. Sister Felicitas Bernardo SPC, Dr. Jesusa Bulotano, and Dr. Alberto Antonio Jr. Their personal stories prove that indeed science, personal discipline, and faith can win the battle against COVID-19. Today, we shall listen to 3 strong advocates of vaccination who have worked tirelessly and endlessly for the health and well-being of our people. Our session today is VAC to the Better Normal. Our first speaker is from the Department of Health and a graduate of Ateneo de Manila University with a degree in political science. He is a health program officer in the Health Promotion Bureau and concurrently the team lead for COVID-19 demand generation and communications task groups. He works closely with Dr. Beverly Ho in efforts to create awareness about COVID vaccines and to campaign for vaccination in the Philippines. Let us virtually welcome to CEAP, Mr. Janus Maclang.
Good morning, everyone. And in behalf of the Department of Health, we thank you for this opportunity. Thank you to our partners and colleagues in the CEAP. We really appreciate any and all efforts by our partners to help improve vaccine confidence and keep everyone informed about the vaccination program. Truly, this is one of the biggest vaccination campaigns that we are undertaking as a country, and it is very important for us to be able to join your communities, even just for an hour or two, to discuss such an important matter. So I will be discussing from a national perspective, how we are rolling out our national COVID vaccination program. I will show you our general framework and approach as a government in order to inoculate everyone and protect everyone from COVID, and to show a brief overview of the different processes that every individual will go through as they hope to get vaccinated. Before I begin, I would like to thank CAAP as well as our partners in the LGUs and the private sector who have been helping us in reaching every Filipino and protecting everyone from COVID. So allow me to begin by sharing with you our overall strategic plan for COVID-19 vaccination. Our national government's approach and vision is clear. We hope to provide safe, equitable, and cost-effective immunization for all Filipinos by 2023. We do this by establishing a sustainable immunization program against COVID with the goal of protecting the public and reduce morbidity and mortality rates due to COVID-19. We've been waiting for these vaccines for a long time, and finally, with the help of these vaccines, we can further improve our response and our protection against COVID. And again, just a recap and a refresher of what we have already discussed in the past few sessions. But why is there a need to get vaccinated? Well, first, it can prevent symptomatic infection. So it can also prevent severe infection, and it can prevent transmission. So before, while COVID has taken many lives now, and it can be very fatal for a person, with the help of vaccines, we are actually reducing the possibility of getting severe COVID. So while it will not 100% eliminate the possibility of getting COVID, at the very most, no, we can only have perhaps some cough, some mild symptoms, but never severe infections, which is why we hope to get every Filipino vaccinated. And our target is to achieve herd immunity, where at least 70% of the population is already vaccinated, and we as a community are protected from the virus. How would we plan on doing this? No? One key strategy or component of our vaccination program is the use of what we call a portfolio of different vaccine brands so that we can reach every single Filipino. As you may know, there are different brand manufacturers all over the world providing different kinds of COVID vaccines. And our goal is to get from these different brands now because of two things. First, there is a limited global supply of COVID vaccines. As we all know, all of the countries are also implementing their own nationwide vaccination programs. And most of the supply of the vaccine has already been used now or have been reserved by richer countries, which is why it's important for us to diversify our sources so that we can have and secure enough vaccines to reach our targets. As you can see here, these are the list of the different manufacturers that we have been in talks with. There's AstraZeneca, Gamaleya, Sinovac, Janssen, Moderna, Novavax, Pfizer, and Bharat Biotech. Some of these vaccines already have an emergency use authorization granted by the Food and Drug Administration. And we can be sure that the vaccines that we will administer are well taken care of and well examined by our scientific experts before they are inoculated and given to the general public. So here's another thing that I would like to highlight on why we are using a portfolio of different vaccines. I know this is a lot, but let's focus, for example, on storage requirements. As you can see, different vaccine brands have different storage requirements, and this has implications on how we roll out our vaccines. For example, if you will notice, Pfizer requires a -80 to -60 degrees Celsius of cold chain storage, while some vaccines such as AstraZeneca or Sinovac require 2 to 8 degrees Celsius. This has implications because one, not the entire country has the capacity to actually shoulder the storage requirements of all the different vaccines. So this will become a problem if we try to reach, and if we really want to reach the farthest of locations within our country. We want to make sure that we can use different brands as well so that we can reach different members of the population. So again, two things on why we're using a portfolio of vaccines is one, to ensure that we have enough vaccines to supply to all Filipinos, and second, to make sure that we actually have the vaccines that we can deliver to different Filipinos across different settings. Next, it's important to note that our vaccination program is driven by experts in the national scale. And these key expert groups are the ones who are making the decisions based on science and based on evidence as to how we will roll out our vaccines. First, we have the vaccine experts panel who asks, should the government allow clinical trials for these vaccines and should we consider it? The Philippine FDA asks the question of, is it safe and efficacious, and do the benefits outweigh the risk? Once it has been proven that it is yes, safe, yes, efficacious, and yes, the benefits outweigh the risks, that is when it is granted emergency use authorization. Next, we have the Health Technology Assessment Council, or the HTAC, that asks the question, should we buy it? It's a question of cost effectivity. asking if we're getting our money's worth, no, and it is worth investing on. Next is the NITAG, or the National Immunization Technical Advisory Group, who answers the question as regards to how should it be delivered to the people. So NITAG generally provides the recommendations for our prioritization, which I will dive into a bit later. And lastly, there is the National Adverse Events Following Immunization Committee, or the NAFIC. Because in the very rare occasion that an adverse effect, an allergic reaction perhaps to a vaccine is experienced, it is important we establish causality and to double check whether these adverse events actually follow or are direct results of immunization, so that we know how to respond to it and we know how to take care and protect everybody from these rare occasions that adverse events are experienced. Next is the question of prioritization. We are approaching this from a prioritization scheme following the following goals or criteria. Our primary criteria is one, we want to maintain our most critical and essential services, particularly healthcare services, because we want to protect our doctors, nurses, and the frontliners in our medical context so that they can in turn protect us. Second is we want to directly reduce morbidity and mortality, meaning we want to focus first on the more vulnerable groups so that we don't have to experience loss of health. Our secondary goal is to substantially control the transmission, minimize the disruption of social, economic, and security functions. And our tertiary goal is to resume to near normal situations, unlike before the pandemic. So let's dive in deeper into that. Given these criteria, this is what the NITAG has operationalized as our prioritization. First is our A1, our frontline workers in health facilities, regardless of whether it is a national or local, private or public, health professionals or non-professional like students in health and allied professional courses who actually perform clinical responsibilities. Then there's also the nursing aides, janitors, barangay health workers who work in medical contexts. Again, we want to protect them so that we can preserve the capacity of our health system so they can continue protecting us. After A1 is priority group A2, which is our senior citizens, people above 60 years old. Why is this? Because in the past year, we have found that COVID is most fatal for our senior citizens. Like, it is more likely for seniors to experience more severe effects to COVID, which is why we want to protect them earlier so that they are less likely to experience severe symptoms. After A2, we go to priority group A3, which is our persons with comorbidities not otherwise included in A1 or A2. So some comorbidities may include cardiovascular diseases, respiratory diseases, comorbidities and conditions that can be exacerbated when they get COVID. Again, with the idea and principle of protecting those who are more vulnerable. After priority group A3, we go to A4, which is frontline personnel in essential sectors, both in public and private sectors, including uniformed personnel, and those in working sectors identified by the IATF as well as NEDA. After A5, we proceed to our indigent population based on the National Household Targeting System for poverty reduction. So if a person qualifies for several different levels here, they can actually get vaccinated in the first level that they are qualified for. So for example, a person who is a senior citizen may have comorbidities. They can already get vaccinated under priority group A2. So after priority group A is priority group B, with B1 being teachers and social workers. B2, which includes me, is actually other government workers. B3 is other essential workers. B4 is socio-demographic groups at significantly higher risk other than seniors and the indigent population, including persons deprived of liberty, persons with disability, and Filipinos living in high-density areas. Then we have overseas Filipino workers, the rest of the remaining workforce. And once all of these are done, we proceed to Group C, which is the rest of the Filipino population, not otherwise included in the aforementioned groups. So far, where do we stand? As of April 20, which is a few days ago, this is the official numbers that we have. In total, we have over 3 million doses of COVID vaccines, and these come from two brands, particularly Pfizer and Sinovac. AstraZeneca and Sinovac. So these two brands are both 2-dose vaccines, We have distributed to our vaccination sites all of these doses, meaning they are within your sites waiting to be administered. And so far, no, we have already administered 1.5% of them, some even already fully vaccinated with their second dose. And on the right side, you can see the regional breakdown of where the vaccines are. We are currently preparing a dashboard so you can see live and updated how we're doing in our vaccination statistics. And we are expecting more and more doses to come in the coming months. No? Even this week, we are receiving a few 100,000 doses from another new brand for our country, Gamaleya. And soon we will be, by next month, we'll be receiving millions and millions of doses from the different vaccine brands that we have procured through the funding of the national government. So this is the last part of my presentation, which asks, no, if, for example, you've already listened to the different sessions organized by CEAP, and you're really excited now, okay, I'm finally ready to get vaccinated, what should I do? So these are the general steps, no, that we will be discussing, and perhaps our next presenters can give you a more detailed look as to what the actual vaccination looks like. But here's the 5 broad steps, no, towards getting vaccinated. First, no, this is actually the first step, is knowing the correct information. Second is getting master listed with your LGU. Third is showing up on your scheduled vaccination date and getting vaccinated. Step 4 is coming back for your second dose. And step 5 is continue observing the minimum public health standards all throughout the process and even after. And let's dive into them one by one. So first, knowing the correct information is crucial before you get vaccinated. We want to make sure that everyone is informed about the vaccines and the vaccination program through legitimate and verified sources. As we understand, no, maraming misinformation that we can see online as well as through our Viber groups, our Facebook Messenger groups, which is why it's important, and we urge everyone to always get the right information first before you get vaccinated. Our legitimate and verified sources first include the DOH platforms and websites. You can check doh.gov.ph/vaccines, no, so that you can be up to date about how the vaccines are, whether you're qualified, and whether a certain vaccine may be better for you if you have specific conditions. And aside from that, we hope that you can also make sure to check with your local health authorities because they will actually be the ones who will administer the vaccine to you. So make sure that you get the right information kung how to get master listed, where is the vaccination site, when is the schedule, etc. So that you know that you are getting authentic vaccines that is administered by your local government unit. And aside from this, aside from staying informed by yourself, we hope that you can be agents of correct information for other people as well. Because the vaccination is not just about us as individuals, but about our community members, no? Our family, our friends. We want to make sure that they are protected with the correct information and again with the vaccine. So once you know the correct information and you finally figured it out, okay, so under priority group A2 pala ako and I'm excited to get vaccinated already. The next step is to get master listed with your LGU. You all know the local government units are the one administering the vaccines, and our national government is working in partnership with our LGUs to deliver these vaccines to you. So your LGU will arrange for the registration, the scheduling of vaccination, as well as identifying the vaccination sites. So we hope that you can wait for specific instructions and announcements from your mayor, your governor, or local communicators within your barangay, as they will be the ones who will provide you the crucial details and the step-by-step guide on how you can get your vaccine. Once you're, halimbawa, nakapagpa-master list na kayo, you've already talked to your LGU and they said, here's your schedule, then you have to show up on your scheduled vaccination date, no? Once you get there, make sure to please wear your face mask, your face shield, stay at least 1 meter away from others, and continue practicing our minimum public health standards. When you get on your scheduled health screening, because on the day itself you will go through some health screening, please make sure to declare your complete medical history. This is important so we can determine which vaccines are appropriate for you, because some vaccines have contraindications or are advised against specific people who may have certain conditions. No person will be scheduled for vaccination without going through health screening, so as to make sure that it is safe and you will not get a vaccine that might not be appropriate for you, and you are actually ready to receive your vaccine on that day. These health screening will be conducted naman during the vaccination itself. So once you undergo health screening, you sign an informed consent form signifying that you are aware of the benefits and risks of the vaccine, and that you're willing to get vaccinated, and you know the processes, and that you're aware now on who to contact in case you have emergencies and concerns. Once you've signed the informed consent form, it's just a very quick when you get vaccinated. I've seen it myself. It takes no less than 5 minutes to actually get the shot in your arm. And after that, you will be placed in a monitoring section where you will be asked to sit down for 15 to 30 minutes. And we have healthcare workers who will be monitoring, just to make sure that you're not experiencing no unusual symptoms or adverse events, no. And to make sure that you are protected and they can take care of you immediately should you have one. And once you finish getting vaccinated, you can then go home, go about your day, and share your hashtag #ResVacuna story. So after you get your first dose, what is the next step? Obviously is, okay, here pala, just a caveat, usual symptoms may be experienced in the next day or so. You may include, it can include some pain, some redness, some swelling on the injection site, as well as a bit of flu-like symptoms. This is usual signs of vaccines, not just for COVID though, but for the other vaccines that you may have tried. And this is a sign that your body is building up protection. And if you feel like the discomfort increases after 24 hours and you think that it is unusual, that's when you can report to the nearest health authority and contact the numbers and details that will be given to you by your LGU on the day of your vaccination. Again, after this, okay ka naman, walang issues, and you've gone about your day, the next step is to make sure to come back for your second dose. Please make sure to come back for your second dose, because only then will you take the full effect and the effectivity of your vaccines. Different vaccine brands have different specifications in terms of when the second dose will be administered. So make sure to listen carefully before you leave the vaccination site on when you should come back. Some vaccines take 2 weeks, some take 4 weeks. And make sure to know what is specific for you. And make sure to clear your schedule on that day, no? Make sure to put it in your calendar, siguraduhin na hindi natin makakalimutan so that we can come back for our second dose. And lastly, after getting vaccinated, we hope everyone can continue observing the minimum public health standards. We want to reiterate that the COVID vaccine is just an additional tool to protect ourselves from COVID. But even after vaccination, you need to practice this minimum public health standards to continually provide protection for yourself and your family. This way, we can be safer from the threats of COVID transmission and avoid the possibility of introducing other variants, etc. So again, the COVID vaccine is not a bulletproof solution. Now, once you get it, you can no longer wear face mask or face shield. Again, the goal of the vaccination is not just for you, but for everyone. We can think about that longer in the way once more and more of us are getting vaccinated. But in the meantime, please make sure to practice this minimum public health standards. And it is at this point, and at this note that I would end my presentation, which we remind everyone that, again, the COVID vaccine is just an additional tool to protect not just yourself, but the people around you. And we encourage everyone to protect one another, not just by getting vaccinated, but by making sure that other people around you are vaccinated and they have the correct and scientific information about the vaccines and our vaccination program. That ends my presentation. Thank you for your time, and I look forward to hearing from the rest of our speakers and our Q&A. Salamat po.
Thank you, Mr. Maclang. I hope that the wonderful assurance is consoling everyone, conscious that vaccination is being rolled out in the Philippines by the government. But there was one critical point that he mentioned: right information is needed. We need to declare what we have and who we are so that the right or the appropriate vaccine can be given to us. So thank you again, Mr. Maclang. We will see you in the Q&A. Our second speaker will give us a local perspective in vaccination rollout. She serves as the Chief of Planning, Training, Research Development, and Evaluation Services of the Health Office of the City of Manila. She is also currently the manager of the Delpan Evacuation Center and Quarantine Facility. She's very much involved in the rollout of the vaccination program of the city of Manila and will surely be able to give a good perspective of what happens on the ground. Let us virtually welcome to CEAP, Dr. Gina Pardilla.
Hi, good morning, everyone. I am so happy that I was given the opportunity to share with you our local experience in terms of translating what Mr. Janus has mentioned a while ago. So I hope I could help you visualize what is happening on the ground, and later on I could clarify questions in our Q&A. All right, I'll proceed. I just would like to reiterate a few guidelines related to COVID-19 vaccination. Mr. Janice has always mentioned regarding distancing measures, cleaning of the facility, and what is very important now in the COVID-19 vaccination is the IT support. Remember, the registration is done online. So we must make sure that even those who are not technically knowledgeable can be given the access to the vaccines. So we need the technical support. These are a few reminders as we go along. Uh, there must be a good flow of the immunization in terms of time management so that the distancing and the crowding is also avoided. So we wanted as much as possible the clients to feel secure, to feel safe with the vaccination so that they get back on the second dose. So there are a lot of administrative measures like taking of your vital signs, providing, making sure that that medical services are available just in case. And then we make sure also that the correct information is given to the clients, all the issues are addressed, and right after vaccination, they know where to go if ever problems arise. Okay, so there are also some technical guidelines related to vaccine, and each vaccine has some different technical standards. This is just meant to show you that what was mentioned by Mr. Janus a while ago, depending on the supply of the vaccine, and then depending again on the type of vaccine, there are different storage requirements. So for purposes of cold chain management, there are technical guidelines that should be observed also. I guess this was mentioned already that there are a lot of available vaccines. So, which vaccines become available to the country is being distributed by DOH to the local government units. And we make sure that we know exactly how to handle these vaccines and explain it, and likewise make our clients aware of what are the possible effects of such vaccination. So it is a matter of weighing really what are the risks against the benefits that each individual client can get from the vaccine. All right. So uh, I wish to go directly to the vaccination process. If you go to any local government unit, the prescribed areas that you need to see when doing a vaccination is, of course, you have a waiting area because these eligible clients will go to the vaccination site. So there must at least be an area where you could encourage comfort, like for example, distancing of the chairs. You have an area for your hand washing and probably a sanitation area with alcohol dispensers, which is readily available. But of course, clients that are allowed to go inside the vaccination site must wear the prescribed PPE. That would mean your face mask and the face shield. We always tell our clients that using your face mask and face shield actually protects you 99%, as said by DOH. So the vaccine itself will not we should not be totally dependent on the vaccine itself. Hence, we need to practice the minimum health standards, even if we are already vaccinated. After the waiting area, we have what is known as a registration area, wherein there is a computer and the QR scanner, wherein because you are pre-registered, you just have to present the QR and then an ID that validates whether that information, which was registered using your QR, is matching with the valid ID or the proof of identification that the client is giving. So this now tells you the eligibility as a priority client based on what was mentioned a while ago, because local government units need to follow certain form of prioritization from A to B to C. And then once the registration is done, we now proceed to a form of a pre-vaccination counseling. Actually, when you do your registration, there are a series of questions that were already asked related to your health. So it is a form of assessment already, so it would not take time. So when the QR is actually generated and we see the information, we see already the risks that the patients are having. So this pre-vaccination counseling actually answers what these risks are in relation to the client, and we also make sure that the client is informed as to what type, all right, what form of protection that she gets. Usually, there is some hesitation because they would tell you, oh, doktora, ako po ay mataas ang presyon ko ngayon. O kaya, ako doktora, may iniinom po akong mga gamot. So, this is the time when our health educators take some form of a discussion so that the clients will feel safe. And then once validated that the upon counseling, upon full the giving of information, and the client is now asked to decide. Because some of them may pre-registered, pero during the registration, minsan na-atras pa yan, minsan natatakot pa yan. So we really need to make sure that their doubts are clarified and the info that they wanted to know is given to them, that they deserve that, they deserve that. So once this is done, they pass to the next station, which is actually the screening. In Manila, who usually does the screening would be the medical officers or the physicians. But in some areas, really nurses and midwives are also allowed as long as they are oriented and they know exactly what they are looking for and they know exactly how the information that was given is to be used in terms of deciding whether to go ahead with the vaccination or defer it. So in the screening, of course, meron tayo dyang vital signs monitoring, the temperature, all right, the blood pressure, and usually the presumption is that the client is well. The reason why is going for vaccination. And on the entrance area, we're already making sure that they are scanned in terms of the temperature. So those who are having probably or feeling some form of myalgia or body malaise or flu-like symptoms are usually not encouraged to proceed unless they also wanted to learn or get a few information, but they usually should not be allowed to get inside the vaccination site, of course, for purposes of preventing what if this is a prelude to the COVID-19, right? So after screening, the physicians or the health workers usually use or refer to a checklist. This checklist is basically also a rundown of information that was also generated during the pre-registration. So during pre-registration, they will say they have history of, say, heart disease, that they are on status post, say, an operation. So there are conditions that need to be clear to the attending physicians, but there are conditions that can be allowed. So this is what we call the decision made by the screening officer, usually the physician, that weighs whether the benefits will outweigh the risk, and this will be good for the client. So if decided, we go on with a vaccination for another station, and usually it is the nurse. Or in other provinces, sometimes there are midwives doing the vaccination. What is practiced here, the reason why we make sure, because the technical aspect of handling the vaccine is should be 100%. So the type of vaccine, how to mix it, how to dilute it, how to use the syringes, how to dispose already of the used syringes, including the usage of your alcohol or cotton, and of course, making your client feel safe and ready for the vaccination. So it is a sort of giving the assurance that even after vaccination, it does not end there. There must be a post-vaccination monitoring. So they are assured that, sige po, punta lang po tayo dun sa susunod na area. Hindi po kayo talaga agad muna lalabas or uuwi because we have to see. Diyan na yung matatakot. Kala ko ba, doktora, pwede pala akong bakunahan. Bakit obserbahan ako? Di ba? So, we need to explain that this is a very new vaccine. It may have different effects on different people, but a few, very, very few, 1 in a million may experience some unwanted adverse side effects. The reason why, usually I show them we are ready. We are ready with the emergency team. We have here the ambulance. We have here persons that could directly address your concern. So in cases only that if ever you get home and you do not feel well, even after the 30-minute observation, we also give the hotline numbers by which they could contact and refer to, and so that their concerns can also be addressed. So basically, that is how the vaccination process go. Okay. Okay, I think I should go directly to the vaccination video. Would you mind? So that they will visualize what I have been telling about the stations a while ago. Because this was already discussed by Sir Janus. So, allow me, please. This is basically to help you visualize what happens in any vaccination site. These are large vaccination sites because we are LGU, so we make use of our public schools with very large areas with good ventilation, where we could set up chairs that could maintain some form of distancing, and we could maintain some form of order when it comes to big participants. While waiting, what happens here is that the clients are given information while waiting for their turn to be uh, interviewed and registered. So this is actually the screening area. Once the clients present the QR, all right, the information is validated, and these questions are actually again asked. This is the set of questions also that they answered when they had their pre-registration. So we tried to validate whether such information were understood, such questions were really uh, not missed during the registration. During the vaccination, we have a lot of vaccinators to keep the number of clients waiting to be vaccinated. So if you have a big room, that would be very advantageous. If you have a large area that is well ventilated. This picture is actually at a bigger area no, this is a school. The other one is, this is already post-vaccination. So after vaccination, some clients would ask you whether is it all right if I stay for longer so that I can also watch myself, or doon po lalabas yung mga iba pa nilang tanong like ano ba yung pwedeng kainin, ano yung bawal, etc., etc. So, sometimes they would ask you Doktora, is it safe? What if something happens to me at home? Paano na yung bakuna? Hindi na ako babalik sa pangalawa? Okay, so this is also the time we reiterate the importance of getting the second dose, as what Janus has said. If people would know where to get help, right, exactly what numbers to contact, exactly what to do, then I don't think they would hesitate to go for the second vaccination. But if ever there are cases that some adverse reactions would occur, we had established already a referral system with our local government hospitals. So these people that are being watched in the vaccination area are transported right away if necessary, and coordination is ready in the receiving referral hospital. So that gives them some form of assurance and makes vaccination really easier for all of us. Okay, so probably I may not be covering the rest of your doubts. I can do that further King later in the Q&A. So that is my presentation. Thank you very much.
Thank you, Doc Gina. Glimpses of what transpires on the ground help clarify the process that Filipinos will have to go through. A typical Pinoy would always want to be sure about what one is getting into, and your presentation just gave us that. Before I introduce our third speaker, I'd like to share with you some reflection questions. We are doing this now because we've noticed in the past two webinars that when the reflection questions are posted or shared on the screen, shown on the screen, people start leaving. The reflection questions are quite critical because these questions help us think about what to do next, how to move forward. So allow me to share with you three reflection questions. The first is, after listening to the webinar discussions, what do I think now of vaccines and vaccinations? We have to recall that a lot of Filipinos are apprehensive, anxious because of what social media has been feeding everyone. And that is why there is fear, there is doubt, there is uncertainty. And if you ask a typical Pinoy, usually the question is, are we safe if we receive the vaccines and submit ourselves to vaccination? Second, how am I being invited to respond to what I have learned in the webinar series? Our goal at CEAP is first to know the science of vaccination. Second is to hear straight from people whose testimonies are strong and who have gone through the experience of vaccination. And third is to find out how we can respond to what we have learned in the webinar series. And the third question is, how are we as a community of families, teachers, schools, etc., being invited to respond to what we have learned in the webinar series? Let's think about and reflect on these questions and find out how we can answer so that we will be able to do some concrete things after the webinar series, that we will be able to contribute greatly to the call of the nation to, vaccinate and to roll out the program so that we all can heal as one and we all can be protected as one nation. From a government agency that is heavily involved in the rollout program on a national level, we listened to the experience of the rollout of an LGU, particularly the city of Manila. Now we take a look at another perspective, the experience of a private company. Our third speaker is a fellow of the Philippine Pediatric Society and the Pediatric Infectious Disease Society of the Philippines. She is an infectious disease expert and vaccine advocate who also serves as the medical director of the Unilab Vaccines and Diagnostics Department. Please welcome to CEAP, Dr. Nancy Bermal.
Yes, so thank you so much, Father Iking, for that kind introduction. And it's really a great privilege to be one of the speakers for this CEAP webinar together with Mr. Janus and Dr. Gina, whom I know way back in med school. So, ang liit po talaga ng mundo. No? So for this morning, let me allow to share with you general science behind COVID-19 vaccine. And then we'll deep dive into one potential COVID-19 vaccine which can be included in the pipeline here in the Philippines to be able to help in controlling this pandemic. So we'll share with you about the data in terms of the safety and the efficacy and the immunogenicity profile of this COVID-19 vaccine. And we'll be sharing some updates about the ongoing big phase 3 trial in the US. Then we'll summarize the discussion. So yeah, I would just like to share with everyone, since Dr. Janus and Dr. Gina shared about the different COVID-19 vaccine that's included, those with an emergency use authorization granted by our Philippine FDA. But just to show to everyone that really, there's a tedious work put into developing this COVID-19 vaccine, which led to the, giving the EUA. So these vaccines, hindi po ito minadali, Kasi one reason why people are hesitant to get the vaccine is they're saying, ang bilis namang dinevelop ng mga bakunang to. Well, there's truth about it, but, the needed steps, were not bypassed, But because we are in a pandemic, there were lots of funds so that to fast track the development of this vaccine, and some of the different phases were overlapped. So from phase 1, once the vaccine has been proven to be safe and immunogenic, meaning nakakapagbigay po siya, nakakapag-develop siya ng enough antibodies. So developers, the manufacturers, the biotech company can proceed to doing the phase 2 and then phase 3. Some overlap may happen, like phase 2B and phase 3. They can overlap, once they have data which can say that yes, they can go to the next phase of the study. Also, we have to remember that the approvals granted to all these vaccines are emergency use authorization. This is not the regular approval na dapat kompleto yung data nila for phase 3. So if companies will able to, demonstrate that the vaccine is safe, it's immunogenic, it's efficacious based on the meeting the primary objective of the trial, then our vaccine experts, the HTAC, will give approval to this vaccine. So an ideal COVID vaccine, it should be safe, it should be immunogenic, should be able to provide long-lasting immunity, of course. It should be able to protect against the disease. And very important, especially in the Philippines, the vaccine should be stable in field conditions. This one, preferably single dose. So EUA has been granted to J&J, the single-dose vaccine, but this company is doing a phase 3 trial here in the country for their 2-dose vaccine. And of course, very important, the vaccine should be affordable. So apart from this data submitted to our regulatory, they also include good manufacturing data to ensure that the vaccine will be manufactured. It will be, a quality vaccine. Okay, so just to review on how do we get protection from this vaccine. No? So once the manufacturers identify the antigen, no? Kanina sinabi natin may different platforms. So kasama yung antigen sa bakunang ibibigay intramuscularly sa braso natin. So once this vaccine with an antigen is injected, inflammatory response already happened dun pa lang sa arm. No? So these vaccines will go into our system, and the immune system will react to that antigen. Most of these vaccines will include the spike protein. If you remember the structure of the coronavirus, so the spike protein is the one which attaches to the ACE2 inhibitor that's present in almost part of the body. But the goal of giving vaccine is to produce antibodies so that when we get exposed in the future from this virus, these antibodies will protect us kasi meron na tayong na-develop na antibodies. So that's called immunity from the vaccine. And in clinical trial setup can be in phase 2B or phase 3. Another objective is to look into the efficacy. Later, I'll discuss ano po ba yung efficacy. So a little about the safety. So there's no single vaccine which is 100% safe because the local reactions, the systemic reactions that are developed after giving the vaccine, these are part of the safety profile of vaccine generated from phase 1 up to phase 3. So these adverse reactions can be mild, moderate, or severe. So yung mga local and systemic like the pain at the injection site, the swelling, the rashes, or the systemic reaction like fever, body malaise, headache, these are expected adverse reactions that manufacturers include dun sa safety profile that they submit to the regulatory. Some adverse events can be classified as serious, like if the adverse event may lead to death, may lead to hospitalization, may lead to prolongation of existing illness, kina-classify din po yan as serious adverse events. So you can have rare adverse events such as anaphylaxis or severe allergic reactions from the vaccine. There are also adverse events of special interest na hindi naman siya local or systemic or hindi siya nag-cause ng serious adverse events like the clotting, the blood clots reported in Europe, in US. So we consider that as adverse events of special interest. So when talking about safety profile, we determine the causality. So yung mga local and systemic, causally related yan to the vaccine. But the other adverse events like the adverse event of special interest, the SAE, the experts, yung sinabi ni Janus kanina, meron tayong regional adverse event following immunization committee, may national na NAFIC. Sila po yung mga experts who will help investigate and identify the causality of these adverse events to the vaccine. But we always say that because vaccines are public health measure, we always weigh the benefits against the risk. So we can have some adverse events of special interest, but if the benefits will still outweigh the risk, then vaccination should continue. Okay, the next one is the immune response. Ito po, these are measured in a clinical trial setup. So if you are a participant in a clinical trial, after signing an informed consent, so you met all the inclusion and none of the exclusion criteria, you will be randomized to receive the vaccine or to receive the placebo. Then, merong time points, pwedeng at baseline, i-measure if you have already antibodies developed from a past infection of COVID-19. Then at some point, the part of the protocol is to measure the amount of the antibodies that you develop after receiving the vaccine. So, kino-compare nila yan dun syempre sa placebo. Some time points like they can get antibody response after 2 weeks, after a month, or after 6 months, or even after a year. So, depende po sa protocol. So, they also measured that's the duration of immunity, Merong hanggang 6 months, hanggang 1 year. And they also measure the memory response. So may mga cells silang binimeasure among these participants in order to know whether the vaccine is able to stimulate memory cells. No? Kasi yung memory cells, once we are exposed to the virus, yan naman po yung magti-trigger, no, sa ating immune system to develop more antibodies. So again, these immune responses are measured in the background of clinical trial. Then another parameter that is measured during clinical trial is the vaccine efficacy. This is the reduction of the disease among the vaccinated group. So when we say there is a 90% vaccine efficacy, there's reduction, 90% reduction in the vaccinated group compared to the unvaccinated group. Now, what we're saying is, these companies will release their vaccine efficacy data, but we shouldn't compare apples to apples because these data were generated in different situations, like different age groups, different countries will have a different epidemiologic profile, and these participants also will have different forms of COVID-19 infection, like they can have mild, moderate, or severe COVID. So when we talk about overall vaccine efficacy, this pertains to the reduction in mild, moderate, or severe COVID infection. Okay? So this, just to illustrate, no, you can see from your screen, no, yung overall vaccine efficacy, they differ, no, from 50.4 in Sinovac and 95% in Pfizer. So, but when you look at the other part of your screen, yung vaccine efficacy rates against severe COVID, all of them provided 100% efficacy against preventing severe COVID, which is what we want, no? Because, our healthcare system is so overwhelmed. So even if we're vaccinated and we get some form of COVID, so you can get protected against severe. Kasi another, no, while I said there's no single vaccine which is 100% safe, there's also no single vaccine which is 100% effective, no? So there are different factors. Pwedeng yung immune response natin would not be able to develop that much immune response as compared to another participant. So vaccine efficacy, these are generated during clinical trial, but in the rollout, one measure of the performance of this vaccine is the vaccine effectiveness, no? So ilan ba sa nabakunahan ang magde-develop ng COVID? So yan po ay kino-collect din natin na data as part of the rollout of this COVID-19 vaccination. Now, as part of yung task for this webinar is to share with you another model, no, ng partnership on the part of a private sector. So just to clarify, kasi kanina may nakita akong slide na Novavax from China. Hindi po. Novavax, this is a US biotech company based in Maryland, which developed the COVOVAX. That's the brand of the COVID-19 vaccine. And Novavax partnered with Serum Institute India, which is the biggest vaccine manufacturer in the world. No, they have several vaccines which are WHO pre-qualified. So Novavax partnered with them to manufacture COVOVAX. And Faberco Life Science, this is a local company here in the Philippines, who is the partner of Serum Institute India. So Faberco will be the one who will apply for the emergency use authorization in the Philippines. And Unilab partnered with Faberco to distribute the vaccine to the private sector. So we're not selling, Unilab is not selling COVID-19 vaccine, it's not selling COVOVAX, but we just want to be to augment, to help also in the vaccination rollout of COVID-19 vaccine, especially for the economic frontliners. So yun po yung relationship of all these four companies. Okay? So what is this COVOVAX? So COVOVAX, this is a COVID-19 vaccine which included the protein subunit, the spike protein of the SARS-CoV-2 virus. And through a nanoparticle technology, they developed this vaccine and added an adjuvant, so called Matrix M adjuvant. So protein subunit vaccine, these are not new. We have hepatitis B vaccine, some influenza vaccine developed using this platform. And adjuvant is also not a new technology. So adjuvant is included in the vaccine to enhance the antibody response. So we have some influenza vaccine and the human papillomavirus vaccine, which also included adjuvant in their vaccine. So this Covovax, so it's a recombinant nanoparticle with matrix M adjuvant. It's already premixed, no? Hindi na po siya i-dilute. So the adjuvant and the vaccine, they're mixed in one vial, and the preparation is stable at +2 to +8 degrees centigrade, no? So yan po ang preparation ng Covovax. So of course, no, always all this vaccine should be science-based, no? And kanina nasabi ko na hindi po minadali ang pag-develop ng bakuna. Similarly for Covovax, they've undergone all these phases from phase 1 to phase 3, no? So safety and immunogenicity from phase 1 to phase 2, the results are published in peer-reviewed journal. They've also doing immune bridging studies like in Japan, because Novavax partnered with Takeda to manufacture Covovax for the Japanese market. So to ensure that the vaccine that will be manufactured there will have the same safety, immunogenicity, and efficacy profile, an immune bridging study will be done the same as with the Serum Institute India, no? Because it's a requirement of the Indian regulatory that clinical trials should be done in India. Okay, so just to share with you the efficacy and safety profile of Covovax in South Africa, where they've done a phase 2B trial, they have enrolled 4,400 adults aged 18 to 65, and they have included 245 immunocompromised HIV-positive participants. So that's the primary endpoint. And at the time that they were doing this trial, 93% of the circulating strain was due to the South African variant, which we know is also circulating here in the Philippines. So from this study, there were 147 cases, yung PCR confirmed COVID, 51 received the Covovax, and 96 received the placebo. So giving an overall vaccine efficacy of 48.6%. But when they did a subgroup analysis excluding or including only the HIV negative, the vaccine efficacy was 55.4. So we know that WHO's cutoff is 50%. No? But from these 147 cases, there were 5 cases who developed who had severe COVID, and all of them received placebo. 5 were hospitalized and 2 resulted in death. There were no participants who had severe COVID who received Covovax. So we can say here that Covovax provided 100% efficacy against severe COVID, against hospitalization and death. So part of the data that was shared to us is the efficacy after 14 days from dose 1. It was 42.7%. And for HIV negative, it was 47.4. So you can see that the efficacy data is not far, no? After 14 days after receiving the vaccine, the dose 1, and 7 days after receiving the dose 2. In the UK trial, where they have enrolled 15,000 adults, the 27% were elderly, there were 106 cases, and 10 received the Covovax and 96 received placebo, giving an overall efficacy of 89.7%. No? So there were also 5 severe cases, all received placebo, and 4 of the 5 were attributed to the UK variant, which is also circulating here in the Philippines. So they also look into the efficacy 14 days after dose 1. So it was at 83.4%. So hindi po siya malayo sa 89.7 vaccine efficacy 7 days after the second dose. So while we're saying na meron ka ng somehow, no, meron ka ng significant vaccine efficacy after dose 1, we still have to complete the dose 2 in order to optimize the protection. So from this trial, no, yung 65 years and older, sabi natin may 27%. There were 10 cases of COVID, but 9 out of the 10 received placebo and 1 received Covovax. No? So the vaccine efficacy against the original strain was 96.4, and the UK variant, it was 86.3%. So what does this mean? Somehow, the Covovax with an original Wuhan strain in the vaccine provided cross-protection against the UK variant strain. So in terms of safety, these are preliminary from the UK trial. So you can see from this in terms of severe, serious, and medically attended AEs, the safety profile are almost similar, no? And from the phase 1 and phase 2, majority of the AEs were mild. There were no severe AE. There were no serious adverse event which caused us temporary hold of the trial. And most of the side effects were headache, fatigue, and muscle pain, which resolved after 2 days. So the US big study, no, which is ongoing, they have finished enrolling 30,000 participants last February. So dito po, from this trial, 65 years and older comprise 13% of the entire 30,000, and they have also enrolled diverse participants. So requirement naman to ng US FDA na dapat different ethnic groups should be included in the study. So I'm sure one of the common question is, are we going to have a booster shot, or are we going to have a vaccine that will contain the variant strain? So Novavax is currently developing this vaccine containing multiple strains. So they will do a clinical trial this year in order for us to have a science-based recommendation whether we need a booster dose or a booster dose with other variant strains. So in summary, Covovax is developed using a well-established technology. This is the first to demonstrate clinical efficacy against the UK and the South African variant. It provided 100% protection against severe disease, including all hospitalization and death. The vaccine is well tolerated with 0 to mild adverse reaction, and because of the significant number of elderly population in the UK and the US study. So this can be potentially given among the elderly and even those who are immunocompromised. So it is a fully liquid formulation. You don't need to dilute, with very good storage condition of +2 to +8 degrees. So it comes in 5 ml dose vial, and each dose should be given 0.5 ml intramuscularly, 21 to 28 days apart. So again, as part of the private sector collaboration, so again, Unilab is not selling Covovax. What the reason primarily why we're doing this is because we know vaccines will not save lives, but vaccination save lives. Thank you so much for your attention.
Thank you, Doc Nancy. We've been hearing from Filipinos about safety, efficacy issues. Your explanation presentation, Doc Nancy, clearly showed the process. We saw the science behind vaccination, and I hope Filipinos are getting answers to their questions. This ends the first part of our discussion. We will take a short break. When we come back, we will take your questions. Well, a lot of questions have already been given to me from our listeners. Meanwhile, let us watch the videos from our sponsors, Tech Factors and Cleaves.
The COVID-19 pandemic has resulted in school closures all across the globe. But even in these uncertain times, education must continue.
Rodrigo Duterte says he won't allow students to go back to school
for a one-sided
continue operating. They have
She
is
talking about the shift to distance learning.
Through this method, teachers deliver lessons outside the traditional classroom setup.
As a leading provider of e-learning materials in the country, Tech Factors Incorporated is committed in helping you and your students experience positive teaching and learning environment inside or even outside the physical classroom.
The DepEdu, we will not anymore have these face-to-face classes with our students. We asked Tech Factor if we can convert to TechTeach. And I'm happy because they agreed to that proposal. So we have scheduled trainings already for our teachers.
The way Tech Factors are handling their schools and the teachers is very accommodating and very commendable because they are there from time to time whenever we need guidance and help in terms of the LMS, in terms of the content.
Congratulations for coming up with very good, effective, relevant, and useful learning materials.
Tech Factors is continuously finding ways to adapt and to adjust in this new normal. I am convinced that being partners with TFI is a big help in this time of new normal.
Tech Factors Incorporated, making learning a great experience. For more information, visit us at www.techfactors.com.
Again, thank you. We are back. Allow me first to greet some CEAP officers, trustees, and participants who are actively engaging themselves in the chat room. We have Father Jobert Villasis of Region 6, all the way from Maclang Catholic College. We also have our president, Sister Marisa Viri, all the way from Davao, and all the other trustees and the many participants from Luzon, Visayas, and Mindanao who are with us this morning. May I remind you again that you will receive the certificate of attendance only upon completion of the evaluation form. The link is already posted in the comment section of this page and on our Facebook page. Again, please note that the link will go live only from 11:30 a.m. to 5 p.m. today. Please answer the evaluation form and you will receive your certificate of attendance within the next 3 to 5 days. A while ago, I read reflection questions for you to personally answer so that after the webinar series, you will know what to do and you'll have your personal takeaway. But I'd like to read the questions again for the sake of those who may not have gotten the questions well and clearly when they were first read. The questions are, after listening to the webinar discussions, what do I think now of vaccines and vaccinations? Am I still afraid? Do I still have doubts? Are issues not clear? Or do I need another webinar for me to get answers to my questions? Second, how am I being invited to respond to what I have learned in the webinar series? Am I now a believer? Can I share what I've learned and the truth about vaccination compared to the myths perhaps and the fake news that we get from social media? And the third, how are we as a community, families, teachers, schools, etc., being invited to respond to what we have learned in the webinar series? There is a call actually that beckons, there is a call that is asking us to respond positively to the vaccination program and to the pandemic so that we all can take part in this. And so now our questions. We have a lot coming from our audience, but before I throw the questions to our panelists, allow me to first give or throw the first question to Sir Janus Maclang. Because our listeners Sir Janus, are actually mostly coming from schools, from our member schools in CEAP. And you mentioned that the B1 sector is composed of teachers and social workers. My first question is, when will the B1 sector be given its vaccination? Will it be before the opening of classes in August or September? So that more or less we can say that if limited face-to-face is introduced before the end of the year, our teachers and our school personnel are ready to take our students back.
Okay, thank you for that question. So the quick answer is we're not sure. So generally, the goal, obviously, no, it's in the ideal situation is we hope to get vaccinated our teachers. And baka nga magkaroon na ng discussions in terms of opening up face-to-face by August or September, no? And that is in the ideal situation. But you must understand, no, that our vaccination program is evolving and it depends on the availability of the vaccines and the supplies that are coming in. The good news is we are expecting doses to come in by the millions starting next month. No, it has been announced, but we're expecting from the vaccines that we have actually procured, no, with our the funds of the national government. They will be finally coming in, no, and we're expecting them by the millions in a scale that is bigger than the first set of vaccines that we have received in the past few months. So with that, we can see, no, we can imagine that the speed of the vaccination program will progress even further as these vaccines come. So I guess we can't really pinpoint, no, and it's very difficult then to promise because ayun nga, the supply chain is evolving. But yes, I agree, no, that is the ideal scenario is to be able to implement that at the soonest possible time. And in the meantime, I think what we could recommend is to our teachers, if you're already qualified for different priority groups, then, for example, you have a comorbidity or you're a senior citizen, then please go ahead na po. You're very much qualified to take it already. And you'll get to know din naman immediately if a vaccination for teachers is already available. Thank you.
School push for vaccination of our teachers so that hopefully a limited face-to-face can be carried out. So I wanted to push that question because I'm conscious of the fact that there is a need for schools to probably observe face-to-face because some of our students who are graduating March next year will be products of 2 years of absence in schools. And that is why this has been a concern among administrators. And we really need to address this. In fact, the question has been, aren't teachers also essential workers, considering that education is also critical to the life of a nation. But anyway, we were getting it, but hopefully we will be able to move faster so that we will be able to vaccinate our teachers ASAP. I'd like to talk to Dr. Gina. One of Father Austriacus' thoughts shared last week in his session VAC to Basics emphasized the need for government to focus 90% of the vaccines in the NCR. No? And he was saying the reason is because NCR has the highest number of COVID cases, and much of he would liken NCR to the head of an animal, and if the head is not moving, the rest would be affected. Now, so my question is, how is government allocating vaccines across the country? Probably Sir Janus can also answer this, but I also would like to hear from Dr. Gina your answers to the question.
Yes, I guess the question is basically dependent on what the answer of Janus is, because the allocation of vaccines comes from the Central Department of Health, and yes, we are allocated more than any other regions precisely because of the reason that the cases are here at NCR. And then what we do in the local government unit is follow the A1, 2, 3 prioritization schedule. So your question a while ago regarding teachers, sir, yes, I do believe that they are very essential part of our everyday life actually. They are actually teaching online. But there is already a move also from government for, this is basically palang for higher education. We actually inspected a few schools in Manila, those who are planning to do the face-to-face exposure for courses like medicine, nursing, dentistry, and so. So we encourage the local government actually scheduled, all right, a special day for this sector, but meeting the criteria of what Mr. Janus said, like they are senior teachers, teachers with comorbidities, then they are eligible. They were encouraged to go at once in the venue, and actually we were able to vaccinate around 800 teachers, sir, if that would give you good news. Okay.
Thank you very much, Doc Gina. Sir Janus, would you like to add to that?
Yes, thank you for that, Doc Gina. In terms of allocation po, no, in terms of the different regions, again, we follow the prioritization framework. So first, we want to make sure that all A1 frontline workers across the entire country is vaccinated. And then pagka across na, A2 na, etc. Sunod-sunod na yun. But in terms po of operationalizing it, then the idea here is the first set of vaccines is usually delivered po to the areas with the greater need for it based on case rates, based on the number of cases that are happening on those regions. So it just so happens po na nauna din talaga si NCR and yung NCR plus area dahil doon madami yung cases. But rest assured po na we still allocate it based on the number of A1. So for example, it's not a question that a lot of population is concentrated in the NCR, and we have a lot of healthcare workers here. So it follows that a lot of the vaccines will come here. There again, the main goal here is to follow the prioritization based on the population and the sectors, and then it's distributed based on the availability and based on the case rates as well of the different regions. But we still continue following the prioritization framework. Thank you.
Thank you, Sir Janus. Actually, it's not only vaccine that is being concentrated in NCR. Even our prayers are also concentrated on NCR because we've seen how things are and what the situation is. So everybody is really doing prayer brigade, praying for the people in NCR so that hopefully we all will be able to get through this. I have a question from one of our participants for Doc Nancy from Sofia Tagiba. She said she got vaccinated last September 2020 for pneumonia. Is there a positive effect on COVID-19?
Father, what's the question? Positive effect on COVID-19?
Is there a positive effect?
A positive effect. Okay po. So the pneumococcal vaccine will prevent pneumococcal infection. And the symptoms of a pneumococcal infection is almost similar to the symptoms of COVID-19. No? So if you're vaccinated, at least the doctors can rule out a pneumococcal infection. And the other positive effect of having a vaccine against pneumococcal pneumonia is we know that for COVID-19, you can have secondary bacterial infection, no? Such as infection due to Streptococcus pneumoniae. So if you have this vaccine, so you can have protection against strep pneumo. So at least hindi na magiging complicated yung inyo pong, just in case, diba, you get COVID and you get severe COVID na magkakaroon kayo ng pneumonia. Somehow you have a protection against that one pathogen, which is strep pneumo.
But I don't want them to get the wrong signal because, but still, even with that protection for that first layer, we still need to get the vaccine for COVID-19.
Yes po. Definitely po. Kasi iba po yung virus ng COVID-19 at iba yung bakterya ng Streptococcus pneumoniae. Hindi po ang ibig sabihin ay meron kayong strep pneumo na vaccine, kayo ay protektado sa COVID. Hindi po ganun yon. So you still have to get your COVID-19 vaccine. Kasi ang mga bakuna, very specific po yung virus o bacteria na ina-attack niya or pine-prevent niya. So yeah, you still have to get your COVID-19 vaccine and even your flu vaccine, no po, no? So isa din yan sa ini-encourage natin na mabakunahan tayo, no, ng influenza vaccine. So siguro para baka may tanong, so kailan na kukuha ng mga bakunang yan, no? So based on recommendation, you can get influenza and pneumococcal vaccine 14 days before you get your COVID-19 vaccine or 14 days after you get your COVID-19 vaccine, just in case you're planning to get these two important vaccines. Thank you.
Thank you, Dr. One of the things that you've mentioned has something to do with herd immunity. And for us to reach that, we need 70% of the total population to be we need 70% of the total population to be vaccinated. Where are we in our goal of hitting 70% of the vaccination based on the total population? Anybody can probably share. Where are we in our vaccination program? Are we close to 70% or we're far from 70%? And the follow-up question, in fact, is considering the age group of young people less than 18 years old is high, plus the number of adults, how can we reach the 70% herd immunity that is required?
Yeah, I think I'll answer since I have the official statistics. So far, no, we've already administered 1.5 million doses. 1.3 is for the first dose, and a lot of the people in the first 1.3 million are still waiting for that window of time before they can get their second dose. But those people have already gotten their second doses at 200,000. Over 200,000. No, these are the numbers that I flashed earlier. So obviously there's still a long way to go, and this is why we encourage everyone to get vaccinated. But we're very hopeful, again, as I mentioned, considering that our vaccine doses will be coming in starting next month. No, we're expecting around 8 million to 10 million. I hope my numbers are correct. But those are the numbers that we are seeing based on the numbers that we have procured, and these numbers are gonna come in steadier, no, starting May and onwards. So we've had a good start, but we can only see it escalating, no, and quickening as more and more of our vaccines come. So there we go. And siguro in terms of reaching herd immunity, that's a very good question, no, in terms of the number of the population. Yes, it's very much possible to reach 70%. And at the same time, no, it's good to also know that some of the vaccine brands are already undergoing trials for age groups below 18, I think. So kapag lumabas na yung recommendation na apparently this brand, no, that we already have in our country, pwede na din daw i-administer, no, nagkaroon na ng data, then pwede na natin i-administer for the younger population. But I guess we highlight that we still prioritize the elderly and the people in specific economic sectors because they're more vulnerable to it, and young people are much less vulnerable to COVID. So I think that's why we continue following the prioritization. Perhaps the others would like to add natin siguro.
Doc Gina, would you like to add? Or Doc Nancy?
Yeah, go ahead, Doc Gina.
Yeah. For the city of Manila, yes, that is basically the goal. We wanted to achieve that 70% so we could have herd immunity. But at the rate that we are going, as I said, we are dependent on the vaccines that is coming to us. Even if we have 18 vaccination sites and a lot of help coming from partners, if we do not have the vaccines ready for rollout, then we cannot do anything. Right now, we only reach around 72,000. Last April 14, and what we're having now at our hands are those left with us. So we are now trying to reach our bedridden senior citizens. So hopefully, as said by Janus, we can receive the vaccines a little sooner, and probably we can roll out a little faster. Hopefully. Thank you po.
Thank you, Doc Gina. Based on the roadmap of government, do we see ourselves getting to the 70% herd immunity before the end of the year? Or
yes, I'm very positive, sir. I'm very hopeful.
Yeah,
As long as people understand the benefits they're getting from it, and the people like you are helping us make people understand. This stops the vaccine hesitancy. This gives more coverage to a lot of people at risk. And hopefully, yes, we are positive that we could reach it, di ba, Janus?
Well said.
Although the issue
We need a lot of help from a lot of people.
Yeah. Although the issue is whether vaccines are coming in. Another issue actually is convincing Filipinos to really get themselves vaccinated, because again, a lot of things are flourishing in social media, influencing greatly Filipinos' mindset and perspective of vaccination. And that's the reason why a lot of them are really afraid of getting the example. I like to throw this question to all of you. Now, this is from Jaya Maghanoy Vidari. She said, what can you say about the case of a nurse who was inoculated with the first dose and then the second dose? But after the second dose, she was inflicted with COVID-19 and she died. I don't know if this is fake news but nevertheless, since this was forwarded to us, we can probably try answering this question. Although we don't know the factors also contributing, because there can be other factors as well, right? But I just would like to hear your thoughts about the question.
I think this is where we highlight why we have the need for, why we have a National Adverse Events Following Immunization Committee, and then regional and local counterparts of that. These are our vaccine experts that do the investigation to double check whether the experiences of parang deaths, for example, or adverse events of a person who get vaccinated is actually related to the vaccines. So first, I think it's very difficult to answer this question, because it will still depend on the findings of the NAFIC and the RAFIC as regards to that particular case. But we want to remind and to highlight that COVID vaccines still provide that layer of protection. And while we have several of these very unfortunate cases where, if for example, this is true, for example, that they've already received 2 doses, for example, and they still got exposed to COVID. But at the very least, you were able to get that kind of protection, to that additional layer of protection to protect yourself. Because at the end of the day, we're in the greater scale, we're reducing the possibilities like this to happen when more and more of us get vaccinated and we achieve that herd immunity. So, ayun, I guess that's and we have to remind ourselves as well na parang, again, the vaccine is not the foolproof, bulletproof solution to anything, but again, an additional layer. And which is why we continue reiterating that our minimum public health standards is important for us to practice until such a time that more and more of us are vaccinated.
May I just add, Father? Yes, may I just add? My take on that is the more we should get vaccinated, because here is a nurse who knows how to handle infection. I know she probably observed, because she knows that what she wanted to do to protect herself. And I know she wanted to protect herself. She already had 2 doses and yet succumbed to COVID-19. Then the more we should not hesitate. If this could happen to someone who is knowledgeable, someone who received the 2 doses, the more it could happen to someone who is misinformed and not getting the vaccine. I would take it on the positive side. Let's say that I think this is one good story that we should all get vaccinated too.
Thank you, Doc. Doc Nancy, would you like to add to?
Yeah, Father. So, for every news, it can be taken 2 sides, the positive side and the negative side. So both Janus and Dr. Gina said it well. And so palagi po yung sinasabi natin, this COVID-19 vaccine, it's an added layer of protection. It's not an all-be-all, especially that, it's a fact that the rollout is taking some time because of challenges in the availability of the vaccine. So one is, yes, please take your vaccine if it's, you're due to get it. And if you get it, please do practice the infection prevention and control measure. Let's all be patient pa rin, until we achieve that herd immunity. There's light at the end of the tunnel, and we've seen that in Israel, in some parts of US. So makakapunta po tayo doon sa phase na yon na makakabalik tayo. Pero sa ngayon, hindi pa po, no? Even if we're all vaccinated tayo, Doc Gina, di ba? We've been vaccinated, pero ganun pa rin, no? Let's practice all these infection prevention and control measures. Siguro yung pinaka-importante, please stay home. Kung hindi niyo po kailangan lumabas ng bahay, please stay home. At wag nating i-underestimate tong si COVID na ito. No? Yeah. Thanks, Father.
Actually, very true, because a lot of people still don't believe in COVID. Now, a lot of people still don't believe in COVID. In fact, when I came back from Manila, one of my friends was asking me, so you also believe in COVID? I said, well, we just have to. No, because it's happening and a lot of people are dying from it. We have a question from Miss Mary Ann Cruz, our Deputy Executive Director. She says, if you had COVID but was asymptomatic, is there a chance that your immune system did not develop the antibodies? Can anybody answer?
Father, based on the pathophysiology of these diseases, no, once you're exposed, once you get the virus, any kind of virus, so your body reacts to it. So you develop antibodies against that virus. So similarly with all the other vaccine preventable diseases like your measles or chickenpox, no, na you can have subclinical chickenpox na hindi mo alam, nagkaroon ka na, hindi ka nagkaroon ng mga all these pock marks, but in seroprevalence study na may data tayo, no? So at least yung mga Filipinos, marami sa atin already developed the antibodies against chickenpox. So I think that's one proof na even if you're asymptomatic, you still get antibodies, no, from these infectious diseases.
Father,
Actually,
may I
this is a similar question, but this one. Sure, Dr. Gina, go ahead.
We're talking of antibodies. You asked a while ago what people can do to contribute to the solution. There are a lot of researches ongoing now. I think UPPGH is doing one on antibodies after developing COVID. So if we had some form of commitment to contribute by having COVID, this is one of the many areas that we could contribute and respond in the field of research so that our experts can have valid data and accurate data, more solid ground on helping us understand more of the disease. So basically, that is one entry again, research participation.
Thank you, Dr. Gina. There is a similar question raised here coming from Oli Mendoza. The question is, do you still need to complete the 2 doses for AstraZeneca if you had COVID before? Because a brother of mine who is working abroad was told that he only needs 1 dose because he already has antibodies. And after 1 dose, he was told that's complete already. What can you say about this, doctors and Sir Janus?
Father, parang mahirap sagutin po yon if we don't have the evidence, no? So while it's true, you develop antibodies after getting the COVID infection and then you give vaccine, this will boost your antibody response, no, from the infection, and then you give the vaccine. But if you don't complete the 2 doses, we don't know how long will this antibody persist, no? Because the data that are provided by these manufacturers are for the 2 doses. And then, as I mentioned earlier, the studies are ongoing, so we will know until when the antibody levels will persist after getting these 2 doses. So remember, these vaccines are inactivated, no? For your inactivated vaccine, at some point, your antibodies will really go down, no? Unlike your live attenuated vaccine na mas mataas at mas sustained yung antibody response. But for inactivated vaccines like your DPT, your polio, these are all inactivated, you need to boost it. So you need to complete kung ano po yung recommended ng manufacturer because they have those data. Pero yung inang scenario, nagka-COVID, binigyan ng Astra, isa lang ba? Hindi po. Actually, the recommendation is if you had previous COVID infection, you can get the vaccine as soon as you recovered, but you have to complete the 2 doses na recommended ng manufacturer. Thanks, Father.
Thank you, Doc. This one man is really the financial side. So probably our DOH and our LGU can answer this. Who is paying for the COVID-19 vaccines? Do we have to prepare any amount? This coming from somebody who didn't mention one's name. Probably anybody can answer.
Sige, ako no. First, it is 100% free. No, the government is paying for all of this, and nobody is supposed to pay for any vaccine. So for linawin ko no, hindi ko diniscuss masyado in depth kanina, pero as we all know, all our vaccines are granted emergency use authorization. This is different from yung usual authorization na binibigay sa mga vaccines na nakasanayan na natin before, which is called the Certificate of Product Registration. Yung vaccines kasi na yon, kapag binigyan sila ng CPR, pwede sila ibenta. So ito yung mga binibili natin sa yung mga vaccines na binabayaran natin, yung mga flu shots, etc. Pero because of the condition that this is an EUA, it's actually one of the main differences there is it's not commercially available. Hindi siya pwedeng ibenta at tanging ang national government lang ang pwedeng mag-administer ng vaccines or sa tulong ng LGUs or private sector through a tripartite agreement. Pero at the end of the day, the national government has dedicated to pay for all of these expenses, no? Kaya people should not be asked to pay for the vaccines because again, it is covered by the government as well as augmented through the tripartite agreement with the help of LGUs and the private sector.
Yeah, I'd like to make a follow-up on that point, Sir Janus, because like we're from the private sector. For example, my diocese in Dumaguete is planning to purchase vaccines, and we were supposed to be keeping in touch with, for example, Unilab, because we were thinking of getting our Covovax through Unilab. How does that happen? Because we're trying to allocate some funds for this. So what do you say about this? If government takes care of all the vaccines and we're not supposed to be paying, so what does purchase therefore mean in this context?
Right. So siguro linawin na lang natin no, that if you're interested in procuring also through a tripartite agreement, the guidelines of that will be released soon, no? And that I think that is the best thing that you can refer to is para din make sure na tama yung masunod na process, no? But how we can imagine going about that process is you can already siguro parang do a check of how many you would like to procure, and I think it's gonna be with the help of the private sector that you can go about that process. But again, I don't really have the details, no, kasi nga mahirap din magsalita because the policy guidelines in terms of the process is not yet available. So ayun, Father.
So as of now, there are no private companies yet or organizations that have really bought vaccines from the sources. Wala pa.
They're all most are in tripartite agreements in talks, no, with facilitated by the national government.
Doc Nancy, you were
yeah, Father. If I may, so sabi nga ni Janus, no, the private companies can purchase through a tripartite agreement. So na-release na po yung IRR for the yung vaccine procurement, yung 11525, now which says the private sectors can purchase through a tripartite agreement, but they cannot sell this. So they have to give this for free for their employees. So libre pa rin po, Father, no, na kasi kung it will be in violation of the law if the employers will ask their employees to pay for this vaccine, no. Yun po, hindi po talaga even sa DOLE, no, dapat libre po itong ibibigay ng mga employers sa kanilang mga employees and dependents.
Yeah, because I heard, without due respect now, I heard that there are companies that are purchasing the vaccines first, but then are asking their employees to just pay for these vaccines through salary deduction. So that is not supposed to be done. That's somehow illegal. So at least that's clear now. Because but if the employer itself, if the employer wishes to purchase for its employees and gives the vaccines for free to its employees, that's okay.
Yes.
Okay. So that's clear because again, like just an example, our diocese is already finalizing things and is intending to purchase as well for church workers and everyone. So I just would like to make it clear. And if organizations, school systems also would like to purchase, at least this is a good guidance. Now, this is a good guidance. Would you like to add to that, Dr. Gina or anybody else before we proceed with the next?
That would be a very kind help, but I just would like to remind that all private companies are willing to engage their own employees in such activity. We could also help you technically. We could assist in how the vaccination process should be conducted, how to monitor the adverse effects. So I think this is where private and public partnership should work well, because we have the technical know-how, we have the people that could assist you, plus you have the willingness and the commitment to further it out to a bigger number of population. So we could work both ways.
Thank you.
Father, if I may add, kasi there are some companies na, let's say, they offer it for free for the employees and their qualified dependents. What about the non-qualified dependents na ini-encourage naman to get the vaccines from the LGU? But in instances na talagang they really want to get the vaccine from the private sector, so I think some companies will just charge the actual cost of the vaccine. There shouldn't be profit. No, at cost lang dapat. I'm not sure, Janus, kung dun sa IRR disease part. Kasi meron talagang iba na they opted to get it. Kasi let's say kapamilya, empleyado, pero hindi na siya qualified dependent. Outside na yan dun sa law, but gusto nila na they prefer to get it from this company and not from the LGU. So I think yung at cost is also being considered without profit because the vaccine shouldn't be sold. No? In fact, if I may share, may ibang doctors, they want to order Covovax. Ang strict talaga is they cannot give this to their patients. No? Yon talaga, bawal. They cannot give the vaccine to their patients, only to their kasi i-refer mo na lang sila, yung kung may pasyente ka, dun sa LGU, but not in our clinics. No, we cannot kasi may mga proseso na dapat sundin. This is not a regular flu vaccine na pwede mong i-administer sa clinic mo. No? That's why we discourage. No? Even some doctors would say, I want to buy for my patients. Hindi po pwede. So we have to follow the national implementation plan in the rollout of this COVID-19 vaccine.
Thank you, Dr. Nancy. So probably, Sir Janus, you can include that in the info drive, how the rollout is carried out and what the private sector should take note of so that everybody who's interested in rolling out a vaccination program will be guided more or less by all these info materials. We're really running out of time, but we still have a lot of questions. Fast talk na lang po, no? Like, are we capable of generating our own? Well, if I go by Father Nick Austriaco's statement, he's trying to develop a yeast-based thing. Although nothing official has been said about it, but it's actually being talked about among people, among circles. So are we generating our own? Probably that's one possible, but right now we're dependent on foreign suppliers. And here is one: is the vaccine safe for breastfeeding mothers? Yes. Which vaccine is appropriate for senior citizens with comorbidities such as cardiovascular disease and diabetes?
Right now, both Astra and the Sinovac are already given a green light. So yes.
After receiving Sinovac, can I still receive another brand after a time?
No. The national government is saying bawal kung maghalo ng brands because we don't know what could happen. Pwedeng walang mangyari, but pwedeng may mangyari. We're just trying to keep everyone safe. We don't know is the idea, so no.
Yeah, Father, siguro po in terms of science, we just have to wait for the data from these companies. Once they know the persistence of the antibody, let's say after 6 months, it starts to go down, then the experts will recommend, okay, you can get another brand or a booster of the same brand.
All right. Next, why are 18-year-old and younger kids not included in vaccination?
For one, wala pa tayong data on, like the vaccine manufacturers don't have data yet in terms of whether it's safe for them. And second, again, they could be along the pipeline, but we're protecting the most vulnerable. And right now, it's elderly people who are more vulnerable to severe COVID.
Because kids with high immune system can easily recover, right?
So far po, ganun yung lumalabas, no?
Based on observation as well.
Yeah,
And
Father, to add, meron pong ongoing studies na po, no, from different manufacturers to know the safety and efficacy of these vaccines for children, no, 18 and below.
All right, thank you. Doc, is it true that few days after you get vaccinated, your immune system gets weak, and that is why there's a high probability of contracting the virus when you get exposed to a carrier a few days after the shot? Is this true? Science.
Hindi na, Father, it's not true na your immune system is down. Your immune system develops that antibodies against from the antigen you receive from the vaccine. But it doesn't mean that you'll be down. No? But yun nga, yung sinasabi natin kanina, no? Vaccines are not the all and be all. So you still have to continue following all these infection prevention and control measures.
Thank you very much to our panelists. I'd love to entertain more questions, but the thing is we really are running out of time, and everybody's excited because probably awareness has been raised and people are getting to be more involved this time. And thank you for your presence, and thank you for your time, expertise, everything. Again, please take note of our 3 reflection questions, answer them individually. And Dr. Nancy Bermal, Sir Janus Maclang, Dr. Gina Pardilla, thank you very much for your presence, expertise, and sharing. The Catholic Educational Association of the Philippines, consistent with the ideals of Catholic education, should, in the words of the Philippine Catholic School Standards, transform the logic of excellence into love for wisdom, passion for truth, commitment to service, caring for others, and forming minds and hearts. By this, we can say that it is the association's serious responsibility to help Catholic schools navigate through the times by unpacking those that are not clear, so that the truth is brought to the light for everyone to see, appreciate, and embrace. The past 3 webinars, VAC to Basics, VAC to VAC Stories, VAC to Better Normal, have been dedicated to this. Kids, careful, huh? VAC is vaccination, because you might think VAC is VAC. No, so tongue twister. Why? These past months, our member schools never stop asking what CEAP stand is on vaccination. Many of our schools apparently have always been looking up to CEAP for guidance. But deeper than simply telling everyone what to do is a noble task of bringing out what is true. I repeat, deeper than simply telling everyone what to do is a noble task of bringing out what is true. And this is what we are accomplishing in the webinar series. From Father Austriaco to Sister Tas, to Ma'am Jesusa, to Dr. Albert, from Sir Janus to Dr. Gina and Dr. Nancy, the common ground was the truth in their journey and experiences. All the presentations were about what is true. They all spoke from the heart. They spoke sincerely. But even when they spoke from the heart, they made sure that their minds managed the guideposts well. Dear CEAP schools, guided by our Catholic identity, let us share the truth that we have learned. Guided by our mission, let us open up our school spaces for vaccination when the call beckons. Guided by our faith and strengthened by our prayer, let us roll out our vaccination programs. Together, may we move forward as a nation, healed, strong, and vibrant. We thank once again Tech Factors Incorporated, our web host, for technically assisting us, and Mr. Armando Cadera Jr., the president of Tech Factors Incorporated. We thank Leafs Publishing and Mr. Lester David Alcaria, the president of Leafs Publishing. We thank Unilab and the Manila Health Department and the Department of Health. On behalf of our president, Sister Marisa Viri, RVM, and CEAP Board of Trustees, Mr. Jose Alan I. Arellano, Executive Director and the National Secretary that has worked so hard. I thank all of you for solidly supporting CEAP advocacies and programs. This has been Father Iking Balongog. Enjoy your lunch. Have a wonderful weekend ahead. Stay safe and God bless you all.
sa ikaw at ako. Natuto sa prinsipyong punyo at serbisyong totoo. Kahalin tulad ni Kristo, isang puwarang Katoliko. Pagkakaisa sa tulong at gawa, masasalamat sa lahat ng alaala. Pagbabago ang misyon sa mundo, magagawa sa biyaya ni Kristo. Ang kabataan may hamon at alay sa ating bayan, maging lingkod at tulad ng pagbabago sa misyon sa mundo. Birhen Maria ang gabay at ang modelo. Sa mundong may bagong anyo, isang bansang may bagong sigla. Dahil sa ikaw at ako, natuto sa prinsipyong kung mundo serbisyong